Welcome back. Well, if you were enjoying the outdoors this weekend, you probably encountered your share of insects. I know I did.
Well, some insects can cause serious injuries, and our health specialist, Beatrice Politi, is here to explain which one in particular can be harmful.
Well, in this case, ticks. And there are a lot of them in Ontario. They can carry something called Lyme disease, a bacterial infection that, if left untreated, can become debilitating. The Public Health Agency of Canada says the number of areas where ticks are found is expanding, raising the risk of human infection. Every day, Robert Manton hooks himself up to heavy-duty antibiotics.
The first week when the symptoms started, it felt like I had a very, very bad case of the flu. And then the week after that, I started having migraines every single day.
After 10 months and 18 different doctors, the diagnosis was Lyme disease. Manton traces it back to a camping trip near Brantford, Ontario.
There was a whole slew of ticks around our campsite. And my wife pulled some off of me and off of a few of the kids.
Ticks crawl around greenery and climb up onto whatever passes by, animal or human.
Lyme disease is a bacterial infection that's transmitted by a little tick.
If you catch it early, okay, you can totally cure it.
But most of what Dr. Joseph Kropp sees are chronic cases. Janet Mitchell had one of the first signs of Lyme disease, a rash that looks like a bullseye.
When I went to the doctor, he said, "Oh, don't worry about it, it's nothing."
It was 4 years before Mitchell was diagnosed.
What is wrong with me? My eye is turned out. I'm walking like a drunk person. My first diagnosis was multiple sclerosis.
Now Mitchell is on an IV antibiotic twice a day. Lyme disease can mimic many other conditions, including multiple sclerosis and Lou Gehrig's disease, and can cause cardiac problems and arthritis if untreated. The Public Health Agency of Canada says doctors need to be more aware of Lyme disease.
The area where the ticks have become, the ticks are established, is beginning to increase.
Typically, diagnosis involves a government-approved test. Manton and others question its accuracy. He took that test. It came back negative.
That test basically isn't worth the paper it's written on.
The test is relatively insensitive in the early stages of the disease, as it takes the body some time to develop antibodies.
It is possible that some people may be infected and yet be test negative.
Manton's test, through a specialized tick lab in the U.S., came back positive. He wants to see better testing and training for doctors to prevent a delayed diagnosis like his.
It really turns your life upside down.
The Centers for Disease Control say that in 2007 in the United States, there were just over 27,400 cases of Lyme disease. In 2008, there were 96 reported cases of Lyme disease here in Ontario. This year, they've got 11 listed. But Lyme disease organizations say the numbers are much higher, as they don't include those whose disease was confirmed by lab tests in the United States. Now, when you're out, watch for signs that tell you ticks with Lyme disease exist in the area, and protect yourself with long sleeves and pants. Tuck those pants into your socks. And if you do find a tick, remove it carefully and keep it for testing. It could be very valuable to determine if you've contracted Lyme disease.